Notice, the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients, thank you. Disruptive Mood Dysregulation Disorder, DMDD, is a relatively new psychiatric diagnosis introduced in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, published by the American Psychiatric Association. This condition is characterized by chronic, severe, and persistent irritability in children and adolescents, which manifests in two main ways: frequent temper outbursts that are grossly out of proportion in intensity or duration to the situation, and a persistent, irritable, or angry mood that is present between the severe temper outbursts. The inclusion of DMDD in DSM-5 was driven by the need to address concerns about the potential overdiagnosis and overtreatment of bipolar disorder in children and adolescents. This was a significant issue as many young patients were being diagnosed with bipolar disorder when their symptoms did not align with the traditional manifestations seen in adults. DMDD provides a diagnostic category for children with severe mood dysregulation, irritability, and temper outbursts without the episodic features of mania or hypomania that characterize bipolar disorder. DMDD is diagnosed based on specific criteria, including age of onset before 10 years, the presence of symptoms consistently for 12 or more months, without a break longer than 3 months, and the manifestation of symptoms in at least 2 settings, e.g., at home and at school. The condition is associated with significant distress or impairment in social, academic, or other important areas of functioning. The pathophysiology of DMDD is not entirely understood, but it is believed to involve a complex interplay of genetic, biological, and environmental factors. Neuroimaging studies have suggested abnormalities in the frontolimbic regions of the brain, which are involved in emotional regulation, may contribute to the symptoms of DMDD. Treatment for DMDD is multifaceted and often includes a combination of psychotherapy, medication, and family support. Cognitive behavioral therapy, CBT, is commonly used to help children develop coping skills for managing their emotions and reactions to stress. Medications, such as selective serotonin reuptake inhibitors, SSRIs, or atypical antipsychotics, may be prescribed to help stabilize mood or reduce the severity of temper outbursts. Parent training and family therapy can also play crucial roles in treatment by helping family members understand the disorder and learn effective strategies for responding to the child's behavior. The prognosis for children with DMDD varies. Early and comprehensive intervention can improve outcomes and help children develop more effective emotional regulation skills. However, DMDD is associated with an increased risk for developing other psychiatric disorders, such as depression and anxiety, later in life. Therefore, ongoing monitoring and support are essential for children diagnosed with this condition. In conclusion, DMDD is a disorder that addresses a critical gap in the psychiatric diagnosis of mood disorders in children. By providing a distinct category for severe irritability and temper outbursts, it helps prevent the misdiagnosis of bipolar disorder in the pediatric population. Understanding and treating DMDD is essential for improving the mental health and quality of life of affected children and their families.